You cannot really say that it is a pathology, it is simply the result of demanding too much from our eyes. It occurs after exerting too much effort. The musculature of the eye is more or less relaxed when we see from a distance, for example, looking at a landscape, but when focusing something closely, it works more. When we spend a lot of time reading or watching a screen, our muscles get tired. We can see this fatigue also when there are constant accommodative changes. This occurs when driving, at which time the eyes frequently shift from near, dashboard or mirrors, to far away, road or highway. When there is little light, the eyes must make more effort to focus, which produces that eye strain we are talking about. Visual fatigue appears more strongly after the appearance of presbyopia or eye strain. When you work long hours at the computer, reading a book, or driving, you may experience what some call eye strain. But did you know that the phrase eye strain means different things to different people? Eye strain is more of a symptom than an actual disease. Some use the term differently. For certain people, it can mean tired or watery eyes, while for others may mean blurred vision. Some may have headaches that they attribute to eye strain, and others may have facial muscle fatigue from squeezing the eyes for long periods of time from not wearing the correct glasses. Eye strain does not injure the eyes and does not cause permanent damage. Although it is worth making simple changes when concentrating on the task to improve eye comfort. Focusing on a task for a long time without blinking can leave your eyes feeling dry and tired. Eye strain from looking at the computer is no different from that caused by driving or reading for hours. Sitting near a fan that blows hot or cold air into your face can quickly dry out your eyes. An incorrect prescription for glasses or contact lenses can cause blurred vision, worsening the sensation of eye fatigue. Working in an environment that is too bright or not bright enough can tire your eyes. If we have poor posture when doing these tasks, we can suffer neck and back pain, which increases fatigue and adds the discomfort that some may attribute to eye fatigue. Tips for working in the office. A few simple adjustments to your workspace can alleviate eye strain from prolonged computer use. Keep a jar of artificial tears handy and place a humidifier near your desk. Adjust your computer screen so that your eyes roll slightly downward. If you have trouble seeing your screen, ask your doctor about computer glasses. These progressive lenses are specifically designed to focus on computer screens and should be located about 20 to 26 inches from the face. Don't forget to follow the 20 rule. Every 20 minutes change where you fix your eyes and look at an object that is at least 20 feet away for at least 20 seconds. If you still have eye fatigue, after adjusting your workspace, your ophthalmologist will be able to help you. During your appointment, describe your eye symptoms, including when they occur and how long they last. Your doctor will check whether or not it is dry eye, examine your eye muscles, and scan to see if you need new glasses or contact lenses. What symptoms do you have? The manifestations of visual fatigue are quite varied, as are the causes. Each person is affected differently. It all depends on morphology and visual habits. Despite this, we go with the most common symptoms. Eye discomfort, you feel warm, prickly, or swollen. They are usually internal sensations, without external manifestation. Sometimes the redness that is associated with eye fatigue is from rubbing the eyes to relieve the discomfort itself. Headaches, this type of pain appears when a great effort is made. We can differentiate them from other pains by locating in the eye and forehead area. They don't just sit on one side of the head. Blurred vision, sometimes it can happen that the images are perceived with less clarity. At that time, if we interrupt the activity we are doing and rest, the blurred vision suddenly disappears. Swelling and redness, many times the sensation of eye swelling has an external manifestation that is usually accompanied by tearing. Mild swelling is not usually confused with allergies or infections, as they are usually much more annoying manifestations. The treatment for eye strain. Eye strain is extremely common. As computer use has become commonplace, more people are experiencing what has been termed computer vision syndrome, which is synonymous with eye strain. In most of these people, the symptoms are mild, and they are aware that their feelings of the eyes being tired can be relieved by briefly closing their eyes and taking a break from the visual task they are performing. The symptoms will often be absent or markedly reduced on days when computer use is more limited. Although eye strain is uncomfortable, there are no long-term consequences of eye strain. There is no evidence that eye strain causes any adverse changes in the eyes. There is also no evidence that, in adults, continuing to do visual tasks while experiencing eye strain will result in any structural damage to the eyes. Eye strain, however, can be unpleasant and disruptive to your ability to concentrate and work. The symptoms of eye strain may lead to physical fatigue, decreased productivity, increased numbers of work errors, and anxiety. If you feel that you are experiencing eye strain after extended reading, try to adjust your lighting to maximize illumination while minimizing glare. Take frequent brief breaks from the visual task and consciously blink a few extra times. Firmly massaging the temples with your fingers in a rotary fashion for a minute while closing your eyes is often helpful in relieving the symptoms. If you experience eye strain while working at your computer, increasing the resolution of your screen and reducing ambient lighting may be helpful. Adjusting the distance of your eyes from both the computer screen and your reading material may also relieve your symptoms. Changing brightness and contrast levels on your monitor and increasing text size can also be advantageous. Rather than keeping your eyes focused on the computer screen for hours at a time, interrupt this process every 15 minutes by briefly looking out of the window or around the room. When performing extended visual tasks of all sorts, occasionally stand up, move about and stretch your arms, legs, back, neck, and shoulders. If the symptoms of eye strain are predominantly those of dryness, and increasing your blink frequency is not helpful, using an over-the-counter tear substitute a few times a day can be efficacious. If all these home treatments don't work to relieve your eye strain symptoms, see your ophthalmologist.